I do.
How are you doing?
Okay. I have a chicken hair.
Oh.
Chicken dance. She's gearing up for Gathering of Nations. Chicken dance.
That's my big plume on top.
Gotta dance your style, Claudia.
What was it, Raylene? Spider monkey?
Can you all hear me? I was connected by the phone earlier, and I had a lot of feedback. I don't know what was going on there, but seems like it's working now. So, who's all here? Claudia, Raylene, Rebekah, LaDon, and Victoria. We have one person streaming in live. Give it a couple of minutes. You know, what's bad about this is that this didn't get advertised. It didn't get advertised. For some reason, the scheduled live stream was not set up. There was nothing there, so I had to start it from scratch. So there may not be some folks that log in because they weren't aware that it was coming, but we're going to go ahead and present anyway. People can watch it later on the recording, and hopefully we'll be able to give them something that they need to hear. Excuse me. Okay, so good morning, Sanai, and welcome to this week's edition of the COVID-19 update for the Pueblo, as well as any HHS updates that we have to present. My name is Troy, HHS Director. I'll be the air quotes host today. But we have a team of Health and Human Services staff that are on, that are going to help make this as smooth as possible. We have Claudia Lente. Hi, Claudia. Raylene Martinez. Hi, Raylene. Rebekah Jolin. Ladon Yazi. And Victoria Martinez. So we didn't have a presentation last week. We had some technical difficulties. And so we would have to make up where we left off, which is really not much of anything because we are still at 0 cases, which is good news. And if everything goes as planned, we'll go into the phase 3, which is the final phase of the reopening for the Pueblo, in 5 days, April 26th. So this is good news because the state of New Mexico last week had a pretty significant spike in cases, especially in the northwestern part of the state, San Juan County, Farmington area. They had a pretty decent spike up there, and the overall cases spiked as well. But that only lasted about a week because, according to the most recent numbers, the cases are trending down again. So I think, this is promising news, of course, because, the expectation was that with the multiple new variations of the variant, BA2, which is the Omicron variant, they thought there was going to be a significant spike in cases across the country that were going to cause a problem for everybody, including us here in New Mexico. But it seems as though so far we're escaping what is being seen on the East Coast in Philadelphia and New York and some of the other major metropolitan areas across the country. So, according to the CDC, the county map for Santa Fe County, we are still in low transmission rates. And so that means 4 weeks after the initial spike from the Omicron variants that came up, there's a BA2.1 and a BA2.2, which are 2 different mutations from the original Omicron variant that appear to be overwhelming some of the communities across the country. Has not reached us, has not caused any major infection rates, especially in Santa Fe County and specifically San Juan Pueblo. So that is kind of the update of COVID itself. And so there are a couple of folks that are on live that are watching or listening. Just wanted to make sure that you all know that if you have questions or comments, there's a comment section that you can include any questions or comments that you might have. But I did want to bring up a couple of things that might be of interest to folks. The FDA approved last week an oral breath testing option for COVID-19. So hopefully we'll have options for doing breath tests. Hopefully it doesn't give people reminders of like a DWI or something like that, because I don't know how it works yet, but they are going to be breath tests and not nasal tests, which is going to make things a lot more comfortable when you need to test for COVID-19. It's the same difference between those folks who were using for example, the Vault testing option, which allowed you to get a saliva test as opposed to a nasal swab to get tested. It made it easier because it was a lot more comfortable. So that's coming down the pipeline. Also coming down the pipeline is the multivariant vaccine from Moderna. That is expected to be available this fall. They didn't want to release it too early, but there is positive news about a multivariant vaccine that will not just cover the current vaccines, the current variants that are out there, but they're going to be manufacturing this vaccine in a way that it will actually work towards future variants as well. The original research and scientific studies were completed by the United States Army, and they had some positive results on this from the beginning. The way that they designed it was to help to make it easier to predict the effectiveness of the vaccine on future variants and not just the ones that are active in circulation right now. So that's really good news, because that means just one vaccine, probably once a year as the variants come up. We'll have to get that, and it will cover all the existing variants that are out there instead of just the primary ones, like the vaccine that is currently available through Moderna and Pfizer. So Moderna has the most recent information about their progress on they're calling it a universal vaccine. So that's going to possibly be available in the fall when everybody's expected to need a booster. So that was one thing I wanted to bring up. I think Rebekah is going to talk about the other news that just came out recently about the vaccine, the masks. And oops, I just hit the button somehow, some way. So Rebekah has some information on that. But overall, the country looks like it is recovering. Of course, fingers still crossed. And that includes San Pueblo, which is what we're most interested in and wanted to talk about today. We've had one case in the past 3 weeks, and that's pretty good considering the cases have been going up around the state pretty much. So that is all I have. Does anybody else have anything to add to the conversation?
Troy? I just wanted to mention about the second booster vaccines that are being administered now to 50 years and older at Santa Clara Clinic and also at IHS in Santa Fe. Santa Clara, you have to come and make an appointment, and normally they schedule them for Wednesday mornings when they're closed. And Santa Fe, I'm not sure how that works, but I'm sure if you call PHS, you can get that there at PHS also.
Yeah, thanks.
So get your shot.
Thanks for bringing it up, Claudia. They did talk about that recently, saying that there is, you still have to make an appointment for the boosters at the Santa Fe clinic, Santa Fe Indian Hospital Clinic. So they are available there. So yeah, that vaccine booster is important, especially since they're expecting to have some sort of a spike of cases within the next couple of months, especially as summer starts coming along. So if you're 50 and older, there are boosters available for you from Pfizer or Moderna. And if you're 12 and older and you have been identified as immunocompromised, you're also eligible for a second booster shot. So if you meet that criteria, any of those criteria, contact your healthcare provider, or you can contact the Santa Clara Clinic or Santa Fe Clinic and set yourselves up to get a vaccine there. Also, there have been a lot of questions. I spoke with Aztec today, and there were a lot of questions from community members apparently about the availability of the oral antibody treatment. The oral antibody treatment has been pretty successful in managing symptoms of COVID-19. If just in case you all didn't know, the oral antibody treatment is available for anyone who tests positive for COVID and their symptoms have developed or started within the past 5 days of them contacting their primary care physician for the medication. And so as long as it's been within that 5 days and you have a positive test, even if it's a home test, you can contact your primary care doctor. IHS, you can still call the COVID hotline there at Santa Fe Clinic, and they can set you up and get you set up for the oral antibody. What is it? Pavlocin? Is that what it's called? I believe it's called. It is available to anybody who is at risk of developing severe symptoms of COVID-19. So if you test positive and you have symptoms, you can definitely contact your primary, or you can contact one of us to try to help connect you with the primaries if you're having a hard time and get you set up for getting your medication. So. Anybody else have anything? Pavlocid. That's what it's called. Paxlovid. However you say that. Paxlovid.
Paxlovid.
There's a lot of weird names that are come out of COVID. The different names of the vaccines are are good examples of that.
Good morning, this is Raylene. I would like to remind you all that the COVID vaccine incentive is still available for individuals that have received. If you are under a certain age, you should show proof of 2 vaccines. If you're over 17, you should have 3 vaccines. Copies of your cards can be sent to the COVID email, which is covid@sinaipueblo.org. If you live out of state, those cards will be mailed to you. So just reminding, everyone that those are still available. If you would like to come by, please make sure that you call prior to coming to the office to make sure that we can have that ready for you upon your arrival.
Hi, everyone. Just in response to that, I think that's a really great incentive for the community members to receive that gift card. So thank you to those who put that together. It was really good to see a long line of individuals coming into showing their vaccination status. I thought that was really awesome that everyone came together and were able to support one another, but also provide that. So, yeah. Another thing I wanted to add was in regards to COVID, we at the CDC are getting information about the status around the nation. And so back in March on the 30th, the 7-day moving average for new cases increased by 5%. Yesterday, we received information that the information received from April 13th and the 7-day moving average showed new cases increased by 19%. So I just wanted to let everyone know that it's really important to continue to be cautious because around the world, things are still taking place. We just want to be careful. And I know going forward, we're doing a lot of traveling. And there's quite a few of us that are going to be traveling next month. So we just want to be cautious and be careful as we're going and moving forward, because we don't know how things will change.
I just wanted to remind the community also that I'm still taking applications for the New Mexico Farmers Market. If you're interested, call me here at 455-4115 or on my cell phone 231-9401, and I have applications available. And for Native Americans, it's 55 years of age and older, and you have to fall under an income guideline. It's 135% under the poverty level. But if you're interested, call me, and I will be around the Pueblo again, making home visits to finish delivering the applications. Thank you.
Yeah, so I wanted to speak a little bit about what's going on around the country, especially in regards to travel. So a couple of days ago, a judge ruled that to eliminate the mask mandate for travel in the United States. So we no longer have a mask mandate in the U.S. for mass travel, either via airplane, train, bus. So what the judge ruled on was based off of sort of semantics. The law that they have in place for public health for the nation goes back to the mid-50s, where they define the need to provide sanitation in the event of a public health emergency. And the judge that was overseeing this case ruled that masks don't provide quote-unquote sanitation. So the CDC has come out stating that they will support an appeal to this decision. And because of that, the Department of Justice is going to pursue that. So you're going to see some things changing as far as travel and behaviors of folks. We really want to emphasize that wearing a mask is effective, that protecting yourself and protecting others is the best way to help circumvent and maintain our zero or near zero rate currently, especially here at the Pueblo, but also in other places. So we might see some spikes outside of us that are probably due to the lacks in masking, especially with travel. And this includes international travel too. So it's really important to remember that, our major cities on the coasts and in other places near us, Texas is a major travel city. There's going to be a lot more people not wearing masks at the airports. Things that you can do that may help with that is obviously wearing your mask, wearing the highest quality mask you have access to still. We still want to see those N95s. But also any eye protection if you're going to be on an airplane or maybe in a bus where you're close to strangers, to prevent, if they talk to you without a mask on, you want to prevent those aerosols and droplets from accessing your mucous membranes, your eyes, and more than frequent hand washing. Wash your hands more than you usually do. It never hurts to wash your hands and then dry and then moisturize. If you run into dry hand problems with commercially available soaps, like the types they use at airports or bus stations or train stations, we need to stay on top of this. Sometimes things get politicized in this nation without getting too into that. And so it's important that we remember that we see each other as human beings and that we want to protect each other. I wear a mask still wherever I go in public. I wear it for me and I wear it for my family and my coworkers. I wear it for me and I wear it for other people. So keep that in mind in the coming days, and we'll try to keep up to date on that mandate and see if it's appealed and see what happens with that. So it's a little bit of a tenuous time. I'm going to be traveling as well and be doing my best to avoid any infection or spread of COVID. And if anyone has any questions about what's going on with that, you can feel free to contact us on the COVID line or via the email. Happy to try to answer your questions as best we can. And just want everyone to stay safe and get your boosters as soon as they become available. I'm looking for mine. I'm waiting, so I'll be excited when that comes around.
One of the things that makes that ruling pretty disappointing is, of course, first of all, it doesn't affect what happens here in the Pueblo. Our executive order is what matters. And regardless of what the CDC says or the federal courts say, it doesn't have any influence on the power that the tribal administration has through the executive order around masking or other public health preventative measures. But what's really scary about this that is going to affect the general public in the United States is that I don't really understand. I don't think that those who are excited about this change realize the implications of this ruling. That ruling can effectively take the power away from CDC in the future for all public health emergency management issues. And that's scary because, we eradicated, polio, or we pretty much eradicated measles in the past because of the work that these organizations did to do prevention work and to control, public health emergencies like these. And, this ruling actually threatens the power that CDC has to regulate activities and actions and keeping the United States at large safe. So definitely going to keep an eye on that because it will have some ripple effects on how people view pandemics and public health emergencies. But I just wanted to make sure that regardless of what this ruling says or what the CDC says or what any public health official outside of the Pueblo of San Ildefonso says, it doesn't affect anything. It doesn't supersede what the executive order says. So just make sure you understand that and don't mix up or confuse those rulings or those guidelines for what we do here in the Pueblo, because it is the tribal administration's responsibility to keep the community safe, and that is what the governor is trying to do with the executive order and tribal council. So I wanted to say those couple of things.
Yeah, thank you. And I meant to mention that I'm honestly I'm a little taken aback by what has happened, and I count myself fortunate to work for a tribe and for San I, because everyone here has upheld a really excellent level of disease mitigation and community and safety. So I'm impressed, and I just wanted to encourage those out there that are listening or listen later, if you do need to travel and you encounter a lot of maskless people, don't let them bully you or tell you that you're wrong for wearing a mask. You want to hold fast to that protection. So I just wanted to put that out there, because some folks these days get a little bold and don't mind their business, and I think we're doing a great job here. So
Okay, well, don't want to end the good news of COVID-19 and the work that has been done to keep the COVID-19 virus out of the community and under control. However, we had to make that point because it is in the news and everybody is talking about it. There does need to be some accountability on each individual, because that's basically what this ruling is trying to say, that it's personal choice, and that the CDC does not have enough authority to do these types of things. So it is personal choice. So that personal choice outside the Pueblo, you probably need to consider the risks that the virus still poses to your family, to the community, to yourself, whether it's an elder or someone who has an underlying condition that puts them at greater risk of developing severe disease. All of those things need to be taken into account when you are making that personal choice once you step outside the Pueblo. Because yes, the freedoms of quote unquote freedoms of not being able to wear your mask outside the Pueblo doesn't mean you're not bringing something back here to the Pueblo and potentially putting everybody at risk. So we have the COVID-19 incentives. If you still need to get your third shot or booster, so make sure you follow through with that. And I think that's all we have on COVID. So anything else from Health and Human Services updates that anybody wants to add before we wrap up?
This is Raylene again. I would like to remind everyone that we have Walk for Wellness on Tuesdays and Thursdays starting at 9 a.m. We meet at the baseball fields, so come out and walk with us. I also would like to remind you all that gym memberships are available for those who qualify in the target population. If you would like to sign up or see if you qualify, you can contact myself, and you will also have to sign some paperwork, and you will also have to complete a fitness assessment, which can be scheduled by appointment, or it's by appointment only, with Victoria Martinez or Troy Campbell. So please make sure that when you do schedule your fitness assessment, that you should plan to be at the senior center for about 30 minutes, because that's about how long it'll take. There are a few members that have taken advantage of the membership already, and they are utilizing the Los Alamos location, and so far so good. So I hope to see many more people from the community, either at Los Alamos, or maybe Troy can see some people at the Espinela facility. Remember, this is to benefit you and benefit our program overall. So please take advantage. Please let people know if you already have a membership at either one of the facilities. Contact us, and we can also assist you in getting reimbursement. Again, if you qualify under the specific guidelines for the program. I also would like to remind you all that we have nutrition consultations available with Ms. Sarah Fallion. If you would like to take advantage of those and you would really like to eat better, of course, when you start a kind of fitness routine, And, you should also be mindful of what you are eating. Maybe you don't know how many calories you should be eating. So those are all things that Sarah can help you with as well. So if you would like to take advantage of that, please contact me and we can get those scheduled for you. She's available via Zoom or she can meet with you in person.
Raylene, did you want to talk about your soreness from returning to the gym?
No. I couldn't walk yesterday.
And so this is one of the reasons why fitness assessments are important. Not to say that, Raylene did anything, that she wasn't supposed to do. I'm just saying that, if you aren't aware of what your current fitness level is, and you try to return to the gym to the same level that you were doing it prior to the pandemic, soreness may not be the only thing you're dealing with. You can get injured. You may get disappointed because you aren't able to do the same exercise effort that you were doing before and quit, which is not what we want to have happen. So having a fitness assessment can help to basically put you in a position where you understand what your current fitness level is. So when you go back to the gym, you know where to start. You don't start at 110 like you were before. You might need to start at 40 or 50 because your body may not be ready. COVID has caused a lot of disruption in people's lives, and the fitness routines that we were all happy about and excited about and participating in prior to COVID, we aren't in the same condition that we were before. So understanding that is important. And Victoria does a good job evaluating and trying to get you to understand with where you are. That way you have something to use as a baseline for when you return to the gym. So
also, the membership does include the classes that are available. There are classes that the Los Alamos location has. So if those are something that you would like to know more about, you can contact us and we will get that information to you. And the classes are at various times throughout the day. I believe the latest one is on Wednesday at 6.
I'll actually post that schedule so people can see what's there, because that might be something that might influence someone to join, because that may be what you like. Classes are sometimes better for some folks than independent working out or just going in there and doing exercises by yourself or with family and friends. So I'll post that on the Facebook page and on the Instagram page for Health and Human Services, so you all can see that. But they do have a pretty decent lineup of classes that might interest you. So stay tuned for that. We do have an estimated time frame of when the Milwaukee Wellness Center is going to have the contract signed. So we're going to add the Milwaukee Wellness Center to the list of facilities here soon. I was told 2 days ago that it should be ready next week. So if that happens, we will probably within the next 10 days have the Milwaukee Wellness Center as an option for working out and exercising too. They actually just opened up on the 15th to have longer hours, because it was only available by appointments during the pandemic at first. So they have expanded their hours and made it a little bit more available for folks. So once we get that information together, we will get that out to the community as well. So you're aware that that is an option in addition to the 2 Anytime Fitness facilities in Los Alamos and Espanola. The way that the fitness program works is there are other options. Those are just the 3 that we have contracts with. If you attend other facilities that are within driving distance, the Los Alamos Aquatic Center, the YMCA in Los Alamos, the Lucero Center in Espanola, some of these different facilities that also have fitness center access, whether you need to swim or do some other kinds of physical activity. As long as it meets the criteria of the program, it is possible that we can enter into agreements with those places as well, and you can get memberships there. But we have to know what the interest of the community is in those areas and for those locations. So if you have any ideas or questions about other options that are within driving distance, and driving distance is, somewhere less than 20 minutes or less drive time to get to it, because we don't want anybody going to Albuquerque or Santa Fe to try to get a membership, because that's not convenient for the community. So, and that's what the program is designed to do, is add access, but with some convenience. So if you have any ideas about other facilities that you might want to attend that are close by, contact us. We'll engage. I have been in conversation with Los Alamos Aquatic Center, so that is already potentially in the works. But what the purpose of this program is to get everyone back to being active, getting out of your house, engaging in physical activity, and trying to get us back to as normal as possible, not just with activities and coming out of our houses, but also with physical activity. We need it. So contact us. We can answer your questions. Anybody else have anything to add before we shut down for the week? Oh, I did want to say that there is a possibility, we have been in discussion, because we have not had a lot of COVID news to report, that the COVID updates may change from a weekly presentation to a bi-monthly presentation every 2 weeks, so that we give some of our health educators more of an opportunity to provide educational presentations as opposed to just focusing on COVID. So that is something that is potentially coming up here soon. LaDawn and Rebekah and some of our other folks who are going to be providing educational presentations have some stuff to present to you all, things that can help to improve our public health within the community, or health within the community. So keep an eye out for the updates on that. And we are really close to starting our community health assessment activities for the community. So keep your eyes out and ears out for the announcements around that as well. So I think we have a tentative date of May 14th that we're going to potentially do one of our survey dates, which is a Saturday. It gives people an opportunity to come in person and fill out their surveys and get your incentive. So that is all I have. Victoria, you have anything?
If you guys are available, just come in and get your fitness assessments done, and that's about it for now.
That's good enough. LaDawn, you have anything?
Not much, just working on gathering information in regards to some of the local, I guess, looking at local foods within the area. So hopefully I'll be able to put something together, some information, and then also an activity, possibly looking at increasing calcium needs, and then the deficiency of vitamin D. So that's in the works right now. So not too much.
Yeah, that vitamin D deficiency is a huge thing in our communities across the country, by the way. So when she gets that together, that's going to be a great presentation. Rebekah, you have anything?
Just wear your masks and get those vaccinations as soon as you become eligible for them. Yeah, no, that's it. Just, wash your hands, wear your masks, get your vaccines.
And still avoid large crowds. Claudia, you have anything?
No, I don't. Thank you.
Raylene?
No, I don't. Not at this time.
Okay. With that said, we've come to the end of our presentation for today. 11:53 a.m. Hey, we finished before noon. That's great news. Thank you all, those of you who did log in and attend and listen to the update. For those of you who may watch this later on and might have questions or comments or concerns, the comment section is still available to you. Put those comments and questions in the comment section, whether it's on YouTube or on Facebook, and we'll get back to you as soon as we possibly can. Hopefully before the next presentation. That way we can have that information, the answers to the questions that you might have or responses to the comments that you might have at the next presentation. So go ahead and enter those in, even if you watch this tomorrow or next week or whenever you get an opportunity to see it. So with that said, those of us on the COVID response team and the Department of Health and Human Services, I'd like to say thank you all, and we will see you next time. The button's not working.